Okay, so I met some great people at the weekend at the SERPA conference in London, and some great content to share. And I met a lovely man called Dr. Howard Scubiner that you might be familiar with, and he's got some great videos on YouTube. He's behind the Curable app. He's has his own app separate to that is training clinicians in persistent pain. And he wrote a book called Unlearn Your Pain. So he's had so many different publications in this field and so well read in it. It's fascinating to listen to, and he did a talk at the weekend. I got the opportunity to chat with him. And just a little bit of content that you might find helpful. He uses a two-step process of determining neural circuit pain. So he talks about the pain, persistent pain, in terms of neural circuit pain, that the brain is firing it. He gives 3 analogies to his patients about pain. I'll do that in a separate video. But in this video, he just splits it into 2 components: ruling out a structural cause of this person's pain and ruling in neural circuit pain. Quite simply, rule it in, rule it out, or rule it out, rule it in. So rule it out. So ruling out structural causes, well, that's the sinister pathologies, cancer and autoimmune disease, undiagnosed fracture, or ongoing active autoimmune pathology or disease. And that comes with tests and lab results and investigations and imaging that all people should have had done, and anybody in pain beyond 3 months should be looking to consider these things as possibilities and sinister causes. And I'm guessing if you haven't had that done, you should have it done if you're a patient with pain beyond 3 months. Thereafter is a physical examination and just looking at the patterns of movement that are consistent with current structural pathology. And after that is looking at the all the imaging finding, the tests, and not really concerned about normal degenerative changes to degenerative disc disease, spondylosis, spondylolisthesis, arthritic changes, facet joint degeneration. Many of the degenerative changes that we see on imaging, they're actually found normally. They are normative for that age group, or that population of patients, because you can see those patients who actually have those changes and don't have pain. So that first part is ruling out the structural cause of ongoing pain. That's the first part. And the step 2 is ruling in the neural circuit pain. And I'll do a video on this separate one about how he breaks down ruling in neural circuit pain through going through a very systematic criteria. So that's Howard's 2-step process. That's the first part of it. I'll do another video on the anecdotes he tells patients, and I'll also do another video on how he breaks down ruling in neural circuit pain, so you can see or build up a picture of maybe how it's relevant in your case or your patient's situations.